Good morning, I'm Mabel Jung, and you're watching continuing coverage of the World Healthcare Congress here in Washington, D.C. We're at day 3 here, and we have our interview select speaker in the chair right now, and this is Co-Chief Executive Officer and co-founder of Oscar. Good morning.
Good morning.
Mario Schlosser, it's so nice to meet you.
Nice to meet you as well.
Now, you have a background in computer science.
Mm-hmm.
Your last job was amongst other things, designing games,
That's
a gaming
right.
platform. And now you're in the business of healthcare.
Uh-huh.
Should you be there?
I think people like me certainly are needed in an industry like healthcare. So we started an insurance company. I run Oscar Insurance Corporation, which is an insurer licensed to sell insurance in New York and New Jersey. Next year, hopefully in Texas and California as well. And we in New York became the first commercial greenfield insurance company in about 15 years or so. As we're going through the licensing in California, similar story, about 15 years or so with no new insurance entrants. And the reason why I think people like me need to go into health insurance, into healthcare, is because from the fact that these founding stories don't happen a whole lot, you can see how little innovation there has been in the industry brought into it from the outside. What we do is we really sort of look at insurance and at healthcare as a consumer product, and we want to build something that from the beginning engages members, that makes them, almost happy to fire up the mobile app and look for a doctor when they need one, and certainly happy with the outcome of having much easier, more convenient access to healthcare through Oscar than without Oscar. And that's something you needed to bring in from the outside into this industry.
Okay, so let me back it up to the history of healthcare and the insurance plans and their role in. Traditionally, this has been dominated by massive giants who have a lot of connected networks and contacts to be able to connect patients, customers to physicians and providers. What is your definition of what health insurance should be?
We like to say that Oscar is the entry point to the healthcare system. So when you buy Oscar, who you are is you are an individual. You don't get insurance coverage through your company. We only at this point sell individual plans on exchange and off exchange, meaning Obamacare plans that you can buy either through the states or through us or through healthcare.gov or through a broker as well. Therefore, who we want to be really is your entry point to the healthcare system. One of the issues I've had before I became an insurance company CEO, I had 2 kids for the past 3 years, and so you ask yourself all these questions along the lines of how do I find a pediatrician that is good? What is the C-section rate of all the OBGYNs who my wife may see in the hospital when we kind of finally come in for the delivery and things like that, because we want to have a natural birth opposed to a C-section birth. And so you want to not end up with somebody who will bias you towards a C-section and these kind of questions. These questions, if you get insurance through your employer, or through a broker and so on, sometimes you have some help with those questions from the HR department, from your benefit consultant, whatever. If you're an individual buying insurance coverage for the first time, in many ways in your life, through us or through the state, which is what happens all the time in this new individual markets, you are on your own. You need somebody to walk you through the complexity of the system. The system is incredibly complex, as you certainly know. We see a huge difference between the cost of a wellness visit, lab test, for example, or over lab tests that may be connected to wellness visits, if that test occurs in a hospital setting as opposed to in a freestanding lab facility, factor of 10 or so in difference in costs. You would not know this as a member unless somebody told you about this. And this is the role in which we see us as the insurance carrier, guide you through the system, get you connected to the most convenient and appropriate care for what you have, and really sort of like help you solve all of your healthcare problems as they occur, as you utilize.
Okay. Now, in terms of your audience, the customers that you're trying to reach, does it appeal to a more entrepreneurial, a younger, a more tech-savvy, an online person who may feel more comfortable navigating a more solitary experience when they're shopping for healthcare?
The goal certainly is we want to make it very broadly applicable. So we didn't set out to create a niche health plan that works for people who frankly already are probably better off in navigating healthcare. The people who really need somebody who guides them through the complex healthcare system is people with complex conditions, is people who are, to whom finances are tight, who need to really watch what they're spending on healthcare and so on. The goal is to make the products applicable and useful and powerful for really all walks, people in all walks of life. In the first 2 years now, we've been selling since October 2013 in New York and now New Jersey as well since last year. We have, I think, gotten members from all walks of life. We index a little bit younger than the state's average in New York. So I mentioned before on stage here that we have about 62% of our members under 45 years old. The state of New York on exchange has about 50% under 45 years old. So we're a little bit younger than that. But by no means are we only a plan of pink eye having Brooklyn-based freelancers, who ride a bicycle. That's certainly not the case. In fact, we also over-index on members with complex conditions and platinum plans. And the appeal to those members really is that by us taking in so much data, taking in so much of the information, making it so intuitively accessible for members, we really make it easier for you to navigate a complex health history. So when you come into Oscar, when you fire up the mobile application, come to the website, one of the things we do is we compile what we call health timeline, which almost looks a little bit like a Facebook timeline in its intuitiveness and simplicity. It has your full health history of everything you've done under Oscar. It has the conversations you're having with the customer care agents, the conversations you're having with the nurses on the Oscar staff, all the diagnoses you've received from your doctors, all the lab tests you've received from lab facilities and so on, all in one place, prescriptions, etc. That's very powerful if you have a complex condition.
Okay. You said walk into Oscar. Do you mean physically walk into Oscar, or is it virtually all online, all the information that Oscar provides?
Information is online, but the physical sort of like aspect certainly is there as well. And I think it comes mostly into play because we have all of our customer care, all of our medical management, all of our sales, all in one building in New York. So we're in Lafayette and Houston, and we do have members visiting us there. I was meeting with a member just last week who had a question about the plan and an interesting idea, and I thought, let's meet up, and so he came to the office and we had a good conversation there. We see it as tremendously important, and this is why I like to say that we're a high-tech and high-touch plan, that we have personal conversations with members. So we do not expect you to fully live online if you want to interact with Oscar, with the healthcare system. It's not realistic. Or in this system, as much as we would like to simplify it to sort of like the really simple ingredients, the contract we still have with a member, it's called the Certificate of Coverage. It's mandated by the states, has a lot of benefits in it that the state basically prescribes for us, is still 100 pages. It's a very complex document, has anything in it from what happens if I want to refill diabetic testing strips to what happens if I have a walking cane and my dog ate it or something like that. It's all in this contract. And so the complexity of the system, you can't boil down to just a website. It has to also come through in conversations with customer service staff, with sales staff and so on, and this is all in the same building with us. And so if you want to reach us, one of the main differentiation points we also have, besides technology, is the fact that a real person picks up the phone right away and then can use the technology on your behalf to see your full history, help guide you through it, answer questions about it, etc.
Both you and your partner are tech guys, so completely well-versed in the tech world.
Yeah.
How long and how did you get up to speed in healthcare in America and all of the insurance questions that come with it?
Fantastic question. I think all of us are still getting up to speed, but that is the case for everybody in US healthcare. So US healthcare is, you can't overstate this, changing a tremendous amount. The emergence of high deductible plans is a very, very new thing for carriers, for members, and for providers, if you will, as well. Providers don't have to balance bill way more so than they had to do before. Formularies are narrower, networks are growing narrower, and benefits are sort of like more defined, crystallized by the states and by the federal governments. It's a new world, constantly really sort of like emerging. Inside of Oscar, what was very important for us was from the beginning to merge the technology and product competence that came from me, for example, and Josh and Kevin, the two other co-founders who came from, as you said, the technology worlds, with decades old knowledge from the insurance sides. And so, as an example, our chief medical officer is the former chief medical officer of Emblem, one of the biggest insurance carriers in New York, one of the oldest ones. I think they just celebrated their 85 years anniversary. Not the chief medical officer we have, but the insurance company
Yes, I got that.
he came from. Our chief actuary, chief financial officer also is from the same plan and had tremendous experience in pricing plans, in doing actuarial math and work before. And so the combination of the health insurance and healthcare experience and of the experience we have on the product building sides, I think is sort of like from the beginning was the magic and is the magic of Oscar.
All right, well, we're going to have to leave it there. Mario Schlosser, thank you so much for your time today.
Thanks for having me. Thank you so much.
And I'm Mabel Jong. Thanks for watching.